You're busy, you've got a decent practice, but nobody wants to be decent. You want to be great, and you want to have a great practice. So how did the most productive, profitable dentist in the nation balance real life, work, and profits, and somehow make it all seem fun? Well, it comes down to simple, everyday practices. So grab a lunch, join us as we chat with top clinicians and influencers to discover their formula for uncommon success. Are you ready? Then it's time to explore everyday practices.
Thank you for listening to the Everyday Practices podcasts with your hosts, Dr. Chad Johnson and Reagan Robertson. That's me. Productive Dentist Academy is helping dentists across the nation right now in real time, navigating the current landscape and helping doctors restore the health of their business and patients. For the first time ever, we are offering Recovery Tactics from the Productive Dentist, an interactive online experience featuring Dr. Baird and fellow PDA advisors Victoria Peterson, Renee Lewis, and Reagan Robertson. The next class starts May 27th. Go to www.productivedentist.com/activate to reserve your seat today. I hope to see you there.
Hi, everybody. This is Chad Johnson. Welcome to Everyday Practices Podcast. Reagan is on special assignment for Everyday Practices News. So she's going to join us probably on the next podcast. So it's just me and Dr. Molloy today. Vijay, how are you doing today?
I'm very well, thanks, Chad. How are you?
I'm doing fine, thank you. And thanks for joining us. Just tell everyone, so it's mid-afternoon for us in Central Time. What time is it for you over in Australia right now?
It is 6:38 a.m.
On a Tuesday.
On a Tuesday morning.
Right, because you guys kind of start the day off. So that is so cool that you started the day off for us and that you, got up early to do this. So my apologies that, it's, joining us at 6:30 in the morning. So that is dedication. I appreciate you joining us.
Oh, you're welcome. What time is it for you?
I'm Central Time, so same as Texas and Minnesota and stuff like that, and Chicago. So we are at 3:30 in the afternoon on Monday.
Oh, right.
Yes. So
yes, of course.
So you're our first Australian guest. So tell us, with all the COVID stuff, how are you guys handling it down there? I mean, this will be just kind of a different perspective, but just to give commonality to people, tell us, how are things different? How are things the same down there for dentists and for people?
Well, our government health body has mandated level 3 restrictions for dentists, which means our services are restricted to emergency treatment only. So no checkups, no cleans. We don't have an end date, but there is speculation that we might be restricted until June. Mm-hmm. So none of us ever expected it to go this far. I was expecting a drop in business. I was even preparing myself for a 50% drop in business because we started feeling the effects around January, and that's when the mask shortage started to happen as well. And luckily my nurse had bought 12 months worth of masks anyway, because she does to get the special deals. But I was like, okay, well, we're stocked up for masks. We'll be okay. We'll have a drop in production. I wasn't actually expecting a full closure. So we can remain open for emergencies only.
Right.
But there are a few reasons why I have chosen not to go on our ADA ADA emergency register. And that is because I felt like, if you were someone who tested positive for coronavirus and you weren't sick or showing any symptoms and you had a really bad toothache, are you going to tell the dentist? I figure you're going to be so desperate to get yourself out of pain, you'll think, oh, it'll be okay, I'll just go to that practice. So that was one thing that concerned me.
Yes.
And then the other thing was, what if I'm a carrier and I don't know it and I make someone else sick? Yes. Or same thing could apply to one of my staff. And, as dentists, we always worry about the legal repercussions. So even if we follow all correct procedure, because this is such an unprecedented situation, we don't know what the legal or the medico-legal ramifications will be if somebody does happen to contract COVID through our practice.
Right.
So there was all of that, and just the stress of it. I have 3 kids, a husband, and I didn't want to risk passing it on to them as well. Plus, I feel a duty of care towards my staff. There are a few of our patients that need emergency treatment, so we'll go in. I'm just selecting the patients very carefully.
I'm kind of doing the same thing. I'm not advertising that I'm seeing emergencies, but if you go to our Facebook page or our website, it does say that we're still seeing emergencies. You know, people can still call. We've done email communication with our patients, but I also haven't. So if you get what I'm saying, we haven't mass marketed that we're seeing emergencies like some people are, and more power to those that are, you know, taking that on and just seeing emergencies. That's cool. But we haven't, you know, gone overboard in trying to market. Yes, we're open. It's just kind of like, yeah, we're open, but just keep it a secret. Okay. I don't know why.
Yeah.
So tell me a little bit about your family. You said you had 3 kids.
Yes, I've got 3 sons. They are 16, 14, and 8.
Okay.
So the longest time I've had off in the last 13 years has been 4 weeks. And that was to give birth to my 3rd child, 2 weeks before, 2 weeks after.
Right.
So I'm treating this time as a bit of a gift. I know, you know, I feel bad saying that because there's so many people around the world that are not so fortunate. Like people are starving in India and probably other parts of the world as well.
Well, so it is a gift.
It is a gift, but
Right.
I feel bad saying that because it's not so for other people. Like this situation has caused so much disruption in the lives of so many.
Well, of course. I mean, but you know, I like that perspective because, you know, to some degree we could get upset and say, wow, you know, like because I have gift X, whatever that gift is, I don't want to enjoy it or appreciate it or think of it as a gift because others don't have it. And it's like, well, wait a second. I mean, you know, I get that. I really do. But at the same time, it's just like, I mean, the idea to a gift is, even though there's a discrepancy, if you do appreciate it and you do enjoy it, that's the difference. Growing up, whenever someone would say, you are spoiled, and I'd, you know, or like your mom spoils you. And we just grew up in a blue collar family. But, you know, when people would say, man, you're spoiled, I'd be like, yes, I am, you know, but there's a difference between being a spoiled brat and being spoiled. You know, a spoiled brat doesn't appreciate it. I'm spoiled and I appreciate it. I mean, you know, and nothing was, you know, any immaculate spoiling and stuff like that. But whenever, you know, something cool would happen, it's like, listen, yes, I do like, you know, that my mom gave me gas money, and someone could say, oh, you're spoiled. And it's just like, yeah, I am, you know, but I appreciate it. There's a difference there.
Oh yeah, there totally is.
No, but you're right though. You know, just because we can, you know, appreciate something doesn't mean that other people are not as fortunate. And for sure, you know, being in Australia is more of an advantage than, you know, some of the other countries and stuff like that. And yet, you know, something interesting, Vijay, that I saw was some of the countries that are, you know, third world are not having the same COVID rates that the first world is because they don't travel as much or, you know, stuff like that. And surely they can get it. But and it could spread, you know, easily in that country if they had the right conditions. But sometimes I think us being in America and in Australia makes for our socioeconomic factors to be able to carry it. So we do have to slow down.
Oh, definitely. And everyone has access to a car, which in some countries they don't. So
yes, or
just
flights.
Even community spread. Yeah, community
Right.
spread. Initially it was the flights, but yeah, now it's the community spread.
Yep. So now you also have your dental office, Vitality Dental.
So I started 5 years ago and I just had a small little room in a medical center and I was sort of like, let's see if I can make this work.
Yes.
It's 1 hour north of where I live. So I live in the northwest area of Sydney, and this practice is on the Central Coast. So it's 60 k's from my house.
Yes.
The reason why I started at this practice was because there were other integrative GPs working there. I liked the idea of a team approach, a collaborative kind of approach. And also from an economical perspective, the overheads were really, really low. It was just a single room. The fit out cost was very low. The reception facility was shared. And I thought being a medical center, there'll be a good flow of traffic as well. So I won't have to spend much on marketing. And all that did prove to be correct. But within 4 to 5 years, with 4 years, after 4 years, it was pretty clear that I'd outgrown that space. And there were some challenges as well because the reception area was common to all the practitioners within the practice. So there was, you know, anywhere between 1 and 4, usually it was 2 receptionists serving about 7 to 10 practitioners. So phone calls weren't answered in a timely manner. There was just, I mean, you know how it is, even when you have your own dedicated dental reception, things can get a bit frustrating.
Yes.
But I just felt like I wasn't going to grow if I didn't branch out, and there was no possibility of putting in another chair. So I thought to myself, well, I've got 3 kids, I've got too much going on, I live an hour away, I can't possibly do this on my own, I need a business partner. So I did find a potential business partner, and we were good friends and things. So I became friends with another male dentist through a course, and I particularly thought it'd be great to go into partnership with a male dentist. So then you've got a male and a female, so we can both, offer the patients a full gamut of service.
Sure.
But I guess everyone has different ideas on how a practice should be run. And people did warn me about partnerships, but I thought, I tend to be quite stubborn and not listen to advice when it's given. And I thought, it'll be fine. But unfortunately, the partnership lasted a whole 8 weeks. So it was a bit of a, sorry.
No. I mean, I was simply going to, get to the point of asking. So if there were 1 or 2 things that a newer dentist, the first thing seems to be when you have an intuition or people telling you, hey, you better make sure that you know what you're doing, and you kind of go against that advice, that's dangerous, right?
Well, my intuition told me it was going to be okay. So I was like, yes, but as the time got closer, look, I guess there was warning signs on both our parts that we weren't compatible, but I guess it's like a bad relationship, isn't it? Sometimes you just persist, you want to make it work. But
well, that, and you don't know necessarily the first day that you meet someone that, it's going to be a bad relationship, right? I mean, you don't always know that.
No, that's right. And we had known each other for quite a while as friends, and on a friend level, everything was fine. But, you live and learn. And what that did teach me was I can do this on my own. I am capable of doing it on my own, which was one thing that I thought I wasn't. And because I guess I am quite a strong-minded person, I also realized, well, I have to be able to do things my way. Otherwise, I don't think a partnership will work for me.
So you got to know yourself better. I had an associate, my first associate lasted 10 months and it didn't turn out so hot. And, but at the same time, I mean, both of us admitted it. Both of us had a good resolution to it, just to, let them move on. And I learned from it. Hopefully the other person, I can imagine that they learned from it. So yes, it was not good to have something not work out, but just as much as any dating relationship, let's say that you said, oh man, that's too bad that it didn't last. And it's like, well, I mean, if it's not going to work out, then why should it last? And if it's not going to last, then at least both people hopefully can be like, all right, let's move on. And one person might resent, that relationship being over more than the other. It's always great when both people don't resent it. But if one person does, resent it over a while, you hope they get over it. I mean, people are resilient for the most part, and they get over it and they move on, and then you learn from it, and then you're a better person from it.
Yeah, I like to think everything happens for a reason, and
Sure.
You learn from every situation. If you can choose to dwell and be bitter, but you're not going to grow, and you're just going to end up a very unhappy, miserable person. And that's how I viewed the current situation.
Good.
You can make the most of it, make the most of the time off, and just try to look for the silver lining in all situations.
Yes. So you also do a podcast, and why don't you tell us about, what the name of the podcast and what you guys are looking to accomplish with it? You have some amazing guests on there. So fill in the American audience to their first Australian dental podcast.
Oh, okay, cool. So the podcast is called Mind, Body, Mouth. I have to credit my husband for that title. He came up with it. And the whole idea behind it was more of a patient resource, or a resource for the general public, drawing the link between the mouth and the rest of the body, because for so long the mouth has been treated as a separate compartment with no bearing on what goes on in the rest of the body, sort of like an isolated box. And that's how we taught about it at dental school. But we've got more and more research emerging to suggest that isn't the case, that what goes on the mouth does have such a bearing on the rest of the body. Like we've known for a long time about gum disease and heart disease and the link there, but now we also know about Alzheimer's being linked to gum disease, and one of my favorite topics is breathing and sleep apnea. So I could talk for hours about mouth breathing. So that's a topic that's come up a few times. And it's also been a really great tool in that if a patient comes in and I sort of think, I might see a child and I'd say to the mother, I think your child is showing signs of sleep disordered breathing. I recommend they have their adenoids out. Then I'll say, well, you don't need to take my word for it. You've never heard this information before, but I'm going to suggest you listen to episode 2 and 3 of the podcast and you can hear from the experts. So episode 2 is an interview with the ENT specialist that I send my patients to and who's operated on my own family. And then episode 3 is an interview with a well-known orthodontist. So then they're not just having to take my word for it. They've got some good sound backing there for their decision-making process.
Yeah. And then it lets you kind of at the moment skip over it rather than browbeating them about it. And if they are interested, they can check it out. If they're not interested, then you were just wasting oxygen and time for going too in depth into it.
Yeah, and people already think dentists are just out there for the money and trying to get the hard sell. So I don't want to be that person. If I'm suggesting something, it's because I want that for that person, because I want to help make their life better and I think they could benefit from it. So
if people want to check that out, mindbodymouth.com.au/
it's actually
podcast. Go ahead.
Yeah, it's actually on Apple Podcasts, Stitcher, and iTunes. It seems to be on all the major podcast platforms. So
yeah, I'll admit I'm an Android guy, and so I went to the website. So yeah, you're right. Just find Mind, Body, Mouth on iTunes, and for us, small people holding out and stuff like that. The other 10% of the people. You can go to the website to check those out. Tell me, along that line, when you were saying, I like letting people know, and then I go into, other stuff, but I mean, it's up to the patient to decide. You guys had Productive Dentist Academy come and do an Australian productivity seminar. Where was that located? And was that in January or was that in December? I forget exactly when that was.
Yeah, they were so lucky. We were also lucky. It was in January when there was no concept of travel restrictions.
Right.
It was so great.
And Victoria came and Bruce came and you guys talked stuff through. I can't really ask if you've fully implemented a lot of stuff, but what resonated most with you?
Well, firstly, I was just so excited to meet them both in person because I'd heard them both on podcasts. I'd heard Bruce on at least 3 different podcasts.
Of course.
I was first introduced to him through the Bulletproof Dental Practice podcast.
Okay.
And he's still relatively unknown here in Australia, which is a shame. It was so great that David, the guy that organized the event, had somehow heard of him. But they're both just such lovely, gracious, genuine people.
That's very sweet.
Yeah, it was just really lovely to meet them in person for a start. In terms of what I took back from a business point of view, we made several pages of notes. So one of the things Victoria suggested was the Carey-Free Club. Yes. She called it the Carey's-Free Club. So we're going to implement that when we get back. We're going to call it the Vitality Kids Club.
Yes.
So that was one thing we will definitely put into practice. Victoria also had this breathing technique. I mean, I've seen it before, but she implemented it throughout the seminar. Breathe in for 4, breathe out for 8, and that was instantly calming. So that was a good little tip. So I've been trying to do that even on patients, when they're anxious, when they're having a injection, breathe in, breathe out slowly, or even on my kids to calm them down. Mm-hmm. So that was a good one. From a business point of view, it got me thinking about the structure of the day completely differently. Look, I don't think in the last couple of months it's just been about survival. So my hourly rate certainly hasn't been there, and it was pretty rubbish, really.
Of course.
My hourly rate. And one of the things I did get from Bruce was, because a lot of dentists that have their CEREC machines, they tend to do them themselves. They're out there. Do you have a CEREC machine yourself?
I do. Yep.
And do you make the crowns yourself?
We make them in-house. Yes. Or do you mean, do I design them?
Yeah. Is it you personally making them?
No, most of the time I leave the design up to the assistants, and then if they run across a problem or an issue, anything that they want me to look over, I'll look it over. Of course, it takes them months to get to that point because we don't just throw them to the wolves. But once they are comfortable, and trained, and they feel comfortable doing it all, then yes, I let them do it all.
So I think that's great. And I think Bruce has an in-house technician, whereas in Australia, a lot of dentists are making these crowns themselves, which in my mind is not really a good use of the dentist's time. And I noticed there's a big difference between how the dental office is run in Australia versus the US. Like, your assistants and your hygienists have scope to do a lot more than ours do. Like, for example, Bruce was talking about the crown cementation process. He said, well, the assistant will cut off the crown, they'll get it all ready for me. All I have to do is go in and put the crown on. We can't do that. We have to be doing the whole thing. So most of our offices will just have, 2 or 3 chairs will probably be the average dental office. It's only the very big practices that will have 8 chairs, whereas it sounds like that's more the usual over in the States to have bigger offices.
Yeah, because we can delegate more, then it allows for us to be more than one place. I'll tell you, the sad thing is that in spite of the fact that we have that, it's not fully utilized, not by everyone. And
well, I only listen. Yeah. Sorry.
Well, I was just going to say it has to do with comfortability level too. Some dentists don't feel comfortable releasing the micromanagement of things. And if they're not comfortable, then I suppose, there's 2 possibilities. Either that's where they should stay, and that's going to be okay for some people, is they're going to have to stay in that, micromanaging the whole process. And that might be a negative look on it, but that they're managing the whole aspect of it and doing it themselves. That's fine. Or they start little by little releasing some of that authority to the assistant or to the hygienist to numb, or, it's depending state by state. So yeah, I really love delegating, but at the same time, it's not for everyone. I think everyone should give it a try, but I understand that there are some people that are just like, Chad, I just can't mentally handle that. That freaks me out. And I'm nervous that my assistants aren't in the right capacity. I've even tried it before. I've tried, releasing it. I'm not saying everyone should try it, but or that everyone should do it, but I think everyone should, at least give it a try and baby steps it. Maybe they're not the best leader at describing what they should do either, so being able to train your assistants. If you don't feel like, leadership is your thing, well, then of course it's not going to be your thing.
Well, dentists are by nature technicians, and they're known to be introverts as well. Yep. So leadership is not necessarily that comes natural.
No.
And also we're type A perfectionist type personalities. Yes. So I think one of the key points that I learned was, if someone is doing 80% as well as you, that's good enough.
Darn right. Yeah. The thing is, do we all have to be Dr. Bruce? No. Right. If someone goes, well, man, Dr. Bruce is producing 3,000 an hour, I'm only doing 300 an hour. You know what? That's it. Next month, I'm going to start producing 3,000 an hour. It's like, whoa, hold up. That's not the point. The point isn't for you to produce 4,000 an hour and try and beat Bruce like it's a game. The goal is to take really good care of your patients. Therefore, that might mean that you want to present more treatment plans to patients that you're kind of letting slip in your mind. And then it might mean also offering finance, so that way your patients can say yes to the treatment that you are offering. It might also mean that your team gets more education, so that way they're talking and co-diagnosing, and that you also give some incentive for them to beat a certain dollar amount in a day. And so that way you can push that limit up to 400 and then 500, and then maybe your max is 550 an hour, but that's still being your most productive you, as opposed to trying to be Bruce. Not everyone is going to be or can be or should be Bruce.
Yeah, totally. And I think one thing that seminar did do was just get me thinking a lot more about every process, how to use my time better.
Good.
We changed the structure of our appointment book. That was also based on something I got from another podcast as well. But for example, an orthodontic check, we would have 15 minutes scheduled. Now I've reduced those to 10 minutes, and just the cumulative effect of those, 5-minute appointments that are 5 minutes shorter throughout the day, before by the end of the day, you have an hour.
Yes. And you know what? Someone could use that hour for
A crown
margin,
prep.
or they could leave early, or they could fit more stuff in. What was your recommendation?
A crown prep.
Yeah, sure. I mean, so you can use it to be more productive, or you can use it to be more efficient. So that way you can leave the office with the same amount of production in less time. There's a lot of different ways to skin that cat.
So one of the things I was planning to do before the world changed was bring in a
that sounds so
therapist.
weird to say before the world changed. But BJ, go ahead. Sorry.
Yeah, so one of the things I learned from Bruce that I thought I'd like to do was bring in a therapist, because in Australia, dental therapists with adult scope of practice, they can give injections, they can do cleans. There's a lot of things that they can do. So I thought, well, that's what I'll do. I'll run 2 rooms and I'll just trial it for 1 day a week, bringing in this therapist. So
Yes.
we'll just have to see how that goes and
Right.
play
But
it all by ear and involve.
in essence, you're insourcing a hierarchy of your time management. So that way you can do what the dentist does best.
Yes, and also the photos. The photos was another thing, but it's also finding the right person. For example, you just need to go with people's strengths. Like if somebody told me I was going to say change a tire, but I probably could have worked that one out. But, make a wedding cake.
Yes.
My wedding cake is always going to look rubbish, no matter how much coaching I have. So you've got to play to people's strengths.
I totally get that. Yeah. What kind of dentistry do you like doing?
I've gone more into enjoying larger fixed pros cases and also implant cases.
Mm-hmm.
But I really like being able to make a difference in people's lives. So I look a lot at the airway. So I like to look at the whole health of a person.
Yeah.
So to give you an example, I had a guy come in with a missing front tooth. We've done an implant for him. We've also sent him to the ENT. He had a CPAP, which he hated, and said, if you've got this implant, means and you've got sleep apnea, it's likely you're going to be grinding really hard on that implant all night, which puts it at a higher risk of failure. Let's get your nose checked out. You'll feel better as well. You'll live longer. Your heart will be healthier. So I like to provide that whole solution rather than just dealing with the implant. Oh, you snore. Right, not my area.
Yes. Well, this might sound a little gross, but for example, when I go cycling out in the country, and so we have a lot of farmland here in Iowa, and you don't see the dust all the time. You might see it when a tractor's kicking it up, but you don't necessarily see it just ambiently. But when I'm out cycling and I'm working out hard, I breathe through my mouth. Well, they say, ideally you should breathe through your nose. And I'm like, yeah, that's nice and all. I mean, I try and do what I can, but there's a lot of times when I'm going up a hill and my heart rate's 170 or 160, something like that. And I'm breathing through my mouth. It's like, call it a bad habit. It just is what it is. Interestingly though, I can go months and months and months without getting any tonsilloliths. And when I get done cycling, the next day from that dust and from the allergens that are affecting my tonsils, it causes the tonsil stones or tonsilloliths, and I can just bet that the next day after a long cycling ride that I'm going to have those. Isn't that really interesting? That just one day of mouth breathing that I'm normally not a mouth breather, but then when I do it, it causes those.
Yeah, all that dust, all that environmental.
Yes, and it's stuff that
pollution.
I don't see. I don't see it. I'm not. You don't see the dust particles. I really don't notice it. But I don't cycle in the winter, and I never get those. And then all of a sudden in the spring, like right now, I'm doing a lot more cycling, and if I ride indoors and I mouth breathe when I'm stationary cycling, no problem. When I'm inside the house or at the workout center. But when I go outdoors, all of a sudden I start getting those, and it's just really fascinating. So it's kind of a gross personal story, but it is kind of interesting that those show up when you're mouth breathing. So mouth breathing matters on on people's airway, and it matters on people's tonsils. It matters on their growth and development, and getting the nitric oxide through their nose, and all that kind of stuff you can talk about with patients. But being cognizant and trained with that kind of stuff makes you more apt to be able to talk about it with patients. Do you agree?
Oh, totally. It's even things like, I'll be able to identify, do you get sore around here? You get headaches, you get neck pain. Do you find it difficult to concentrate? Or a child, is this child, are they an ADHD candidate?
Yes, exactly. All right. So here's our last question, Dr. Vijaya Molloy. It's one or the other, or I suppose the answer could be both if you want to be totally politically correct. Okay. But let's get
Let's not be correct. Yeah. Okay.
All
Cool.
Right. Bacon or eggs?
Oh, bacon.
Well, I apologize about the silly question at the end, but it's kind of fun for us to ask. So
Yeah.
Dr. Vijaya Molloy, thank you for joining us so early on a what is this? On a Tuesday morning?
Tuesday morning.
For Australia. So you have a great day, and to all of our listeners for Everyday Practices, thanks for joining us. Dr. Vijay, thanks for joining us.
Thank you.
Bring your lunch or take us to the gym again next week to improve your everyday practices. Also, subscribe on iTunes, follow us on social media, and sign up for our email list. Now get out there and win with Everyday Practices.